Welcome everybody. Thank you for joining us. My name is Julia Shannon-Grillo, and I'll be hosting today's segment on ballot item number 7, which is should Vermont raise the tobacco age to 21? So I'm going to let our panelists introduce themselves. Dr. Gogo, do you like to start?
My name is Propero Gogo. I'm an interventional cardiologist at the University of Vermont Medical Center.
And my name is Mariah Sanderson. I'm the director of the Burlington Partnership for a Healthy Community, which is a substance abuse prevention coalition that serves the Burlington community.
I'm Tatiana Byam. I'm a student at Edmunds Middle School.
I'm Joan Shannon. I'm a city councilor in Burlington, and I've been a longtime activist on tobacco issues.
Great. So I think we'll just jump right into the questions. Joan, can you explain to everyone what the ballot item asks voters to do on March 6th related to increasing the tobacco sales age?
What we're really asking for, I'll just briefly read it. The question is, shall the voters of Burlington advise the governor and members of the Vermont General Assembly to support raising the age of sale for tobacco products in Vermont from 18 to 21 years of age? And what we're really trying to do here is show that there's community support for this effort to get the discussion going in Montpelier.
Great. So this one goes to everyone. Why raise the legal age to sell tobacco products to 21? Why does this matter to you personally? If anybody wants to jump in.
Well, I think I could say from a physician's perspective, it's the #1 preventable cause of death in the United States, and despite very good moves towards reducing the amount of smoking in America over the last 50 years or so, there are still a fair amount of people that continue to smoke, and still many teenagers that begin to smoke every year. So if this is something that can be prevented, I think that would be lead to significant improvement in the health of all Americans. I think you could look at it this way. Tobacco is so dangerous over the long term. You can take for example, take a 6-sided die, a pair of dice, or just one of those die. You take a blank die, but paint one side red and the rest white. A lot of people think that's their risk of developing a problem from smoking. But in actuality, if you take 3 of those sides of the 6 and paint them red and take a roll, that's your chance of developing some kind of smoking-related illness. And so really those are the chances that people don't realize, and maybe even some teens don't recognize when they make the choice to start smoking amongst all the peer pressure they experience.
Great. I think as someone, we're in the organization that I work in, we're looking at what are the things that help teens to grow up and not develop an addiction or problems later in life. And we know that there's kind of 3 substances that we really need to pay attention to, and that's tobacco and alcohol and marijuana. And the longer we can delay that someone starts using something, the less likely they are to develop dependence. So we know that if we can raise the age that people start or they get access to tobacco, the less likely they are to start using and the less likely they are to develop a dependence. The earlier they start, the more they'll use over time and the more likely they are to develop a dependence. So delaying use is really important. And also I think in addition to all of those health consequences that Dr. Gogo was talking about, we know that we had a really great success for a long time in reducing the tobacco use rates in the United States and in our state. Vermont really was a leader in the beginning of that, around that issue, but the tobacco industry has figured out a way to adapt to some of those reducing rates. So they've come out with new products like e-cigarettes and vapor-related products that are raising the percentage of youth and young adults who are using. So we as a community and as a state need to figure out how are we going to adapt to, what are we going to do differently so that they don't bring our use rates back up again.
Well, 95% of adult smokers have started before the age of 21. So if we raise the age to 21, then that will eliminate a lot of people who could get addicted to smoking, and that's really important to me because I don't want to see people who I've known for my whole life or half of my life get addicted to cigarettes and then get an illness from it or die prematurely from it.
I think it's particularly concerning for me that we know that the tobacco companies are actually targeting our kids. And as Tatiana just said, we know that people are mostly getting addicted when they are under 21. So the more we can fight on this end, we can help a whole lot of people not get addicted in the first place. And you know, there's always going to be people who get a hold of it before they are of age. That happens at 18, but if you can boost that age up a little bit higher, it makes it a little bit harder to access at the high school level.
That's great.
So, Mariah, what are the use rates for tobacco in the U.S. versus Vermont now, and is this different in Burlington?
Yeah, so as we've been talking about, the use rates have been going down in our state and across the nation for cigarette smoking, I should say, not tobacco products and all. But the rates across the nation are at around 18% for adults, and here in Vermont, I think we're closer to 17%. For youth, we're down in Burlington of high school youth using to a little under 9%, which is great. I think our state average is about 11%. So we're seeing in our community there's less people using or smoking cigarettes. But what we're seeing in Burlington High School and just across the Vermont that the rates of youth who say that they've used a tobacco product in the last 30 days is more like 25%, which should be very concerning to all of us. I think in Burlington it's 24, but so that's, 1 in 4 of our students have used a tobacco product in the last 30 days, and that's the piece I was talking about of people using those electronic cigarettes or hookahs or vapor products that are honestly sometimes more accessible and easier to hide.
And where are these statistics coming from? Are the students being surveyed? I think I remember hearing something about a survey that came out last year.
Yeah, so in 6th through 12th grade in Vermont, all students take a survey about risky behaviors called the Vermont Youth Risk Behavior Survey every 2 years. So that data is from the last time students in Vermont took it, which was 2015. And I'm sorry, they took it in 2017, but we don't have those results yet. And it'll be really interesting to look at. So the questions around the tobacco products and what we know, that rate of 25% of students using was the first time that question was ever asked in 2015. So we don't know whether it's changed or not, but when we get the results from 2017, it'll be really interesting to see, is that going up even more or down, or that'll be something we really need to pay attention to.
There is an issue with vaping products and e-cigarettes. A recent study came out showing an association of much higher transitions into cigarette smoking amongst teens who have used vaping products. So, most teens who start smoking have never used vaping products, but if you use a vaping product, you're much more susceptible to starting a habit of cigarette smoking. So that's an association. It's not a cause and effect, but still it's there, that it suggests that if you use a vaping product, you're more likely to begin combustible cigarette smoking.
And Tatiana, what does tobacco use look like for youth from your perspective, and has it changed?
Well, I think a lot of the times it'll just be sort of someone sneakily trying to use something that doesn't look quite right. And I think it's changed a little bit because people used to be more common, and now it's sort of less common, but I think some people it might look a little more like someone's trying to hide something.
And why Burlington? What is the benefit of the voters of Burlington voting on this as a ballot item instead of, shouldn't it be a state issue?
Well, I guess I'll take that one. Why Burlington? Well, Dr. Gogo contacted his city councilors in Burlington, and we decided to take it up, and it has to start somewhere. I will say when actually back in 2004, I think, I was asked by constituents to put forward an effort to ban smoking in clubs and bars. And that actually did result in a statewide ban. As we took it on in Burlington, we started to see other cities adopt the same policy. You know, Winooski did it, South Burlington did it, and the next thing we know, where the state had been resistant to doing it, now the state was interested, and within a year, the state banned smoking in bars and clubs. In this case, the city of Burlington does not have the authority to make this change independently of the state of Vermont, but you always have to start the conversation somewhere, and I think that, you know, Burlington's the largest city in Vermont, so why not start here, send a message to Montpelier, and this could become a ballot item in other communities as well. Or perhaps the state of Vermont will take up the action before that happens. But if they're not taking it up, I'm sure we'll continue in other communities to try and put this question on the ballot.
So we've seen in the past that Burlington has a strong enough influence to sway the state.
I think Burlington definitely has the opportunity to be a leader on different issues. And also, if you're going to poll a group of citizens in Vermont, because we're the largest city, this is really the largest poll you could have to influence the legislature.
And what type of tobacco products would this apply to?
The language is non-specific, but you would always have to craft legislation that fleshes out all of the details. But I think that our expectation is that it certainly would include e-cigarettes, vaping products. Our ordinance in the city does include chewing tobacco and e-cigarettes, vaping products, so the whole spectrum of tobacco-related products are included in the ordinance that we have now related to tobacco, and I think that that's the expectation of what we would be asking Montpelier to take up.
And I don't know how familiar you or Dr. Gogo are with juuling, which is like a form of vaping, but I believe it's just nicotine. That's definitely risen in the past few years, but this wouldn't apply to that.
It would apply. So the state last year, or I think the year before, passed a law to regulate vaping products and e-cigarettes to the same degree as tobacco. So the same laws statewide apply to those products as tobacco. So
Okay.
if it's a nicotine substitute or something that you inhale, it would be, I would assume, it would be part of that legislation.
Okay.
Can I add to your question about why Burlington too? I think one of the things that when we talked about the use rates for tobacco at 18%, that doesn't, there's certain populations that where the use rates are much higher, and they're kind of disproportionately affected by tobacco, by problems related to tobacco. So I think in Burlington we see much more diversity in the people that live in this city and who come to the city for services as well. And we have in our community the Turning Point Recovery Center that supports people that are in recovery, and a lot of the human service field. And we know that among those populations, the use rates is much higher. So it's more like 25% of the adults that are that either have a dependence on other drugs or mental health issues, that see much higher tobacco use rates. So it really makes sense for our city to think about how to support people to not pick up a habit that's gonna really hinder their success in other things that they're trying to do as well.
And won't kids just get somebody older to buy them these products? Or?
That is an excellent question. And it's actually one of the, I think minimum age laws are one of the most effective ways to keep substances away from younger ages. So we have our, our alcohol at the age of 21. Now we've legalized marijuana, and that's been put at the age of 21. And the reason is that when you're 18, you're still in high school sometimes, right? So kids in high school have access to that senior in high school that's 18 and can purchase tobacco products for them. So pushing the age just a few years older really limits the access that kids have to somebody who can purchase for them.
So most of the underage kids who are getting access to it now, you'd say, is through students at their school because of the age?
Yeah, I mean, from our youth risk behavior survey, people who say they've smoked tend to say that they get it from other friends.
And Tobacco 21 is not supposed to be a 100% proposition. Just because we raise it doesn't mean kids won't get access to these things. But the Institute of Medicine looked at this very carefully and showed that they suggest that passing Tobacco 21 in a locality will reduce smoking rates among 15 to 17-year-olds by 25% or more. So that's really it is we're just trying to make it a little harder to start a habit that may be very difficult to stop.
And Tatiana, do you have anything to say about how underage kids are getting access now, or have you seen?
Well, I think it's, again, with getting access, knowing that there's the older student, like probably once kids get to high school, they're thinking, oh, there's a senior who's 18 and has access to cigarettes, and I want to try it. And they might seek out a senior who would be willing to get them some cigarettes, and then if they start it, they might not be able to stop.
Is there any evidence that kids are getting tobacco products from their parents, or how prevalent is that?
There is a question on the YRBS that asks, like, did you take it from somebody without knowing? That's not the way it's worded. I can't remember exactly how it's worded. It's a much smaller percentage, but yes. So it could be taking it from their parents' homes.
It's also other family members, slightly older siblings. So the literature on this is that there's, even though it's some older students, there's still, this pipeline won't stop older siblings who are above the age of purchase to supply it to their younger siblings.
And now with the legalization of marijuana, if that has a stronger presence in homes, I would think that it would make it a little bit easier to access.
This is another way to also think about, because a lot of the products that are created for using nicotine can also be used for some forms of marijuana, things like juuling and vapor products and e-cigarettes. So it's just another way to kind of keep it out of the hands of, make it less, or not as easy for younger folks to use marijuana as well. Helps protect our kids.
And is there a cost savings that comes with the higher age limit?
I wouldn't be able to speak to it in terms of immediate savings. I can say that there is a cost savings for the degree of disease that is associated with the start of tobacco smoking for a lifetime. You can imagine that we do a fair amount of procedures every year on patients who are smokers and they have smoking-related heart disease. Those procedures are not cheap, and it's again another reason why preventing something way up front can prevent something way down the line. In addition to the amount of money that people spend on tobacco cigarettes personally, that is income out of their pockets. It's going to something that they can't stop. Especially with the taxes as they are, smoking is not a cheap habit. So it's a personal savings from my standpoint as well. That would be more immediate than, it's like a tax cut, if you think about it that way.
And I can add to that, I took some data from the American Lung Association. They put together kind of a report every year around some of the costs to our state of tobacco use. So the most recent analysis shows that tobacco use in Vermont costs us $348 million in healthcare related costs and $232 million in lost productivity every year. So hopefully that by reducing the number of people that become dependent on it, we can reduce some of those costs, I think. One of the things we haven't talked about, or I think you talked about a little in the beginning, is that there's still, I think there's this myth that we've solved the problem of tobacco sometimes, that because we have made such great progress, but still just under 1,000 Vermonters are dying a year from tobacco-related illnesses. You could go to the Department of Health website and they have this campaign called 3450, which shows that there's 3 behaviors that are causing 50% of the deaths in our nation, in our state, and one of those 3 behaviors is tobacco use. So it's still a really big concern that we need to be doing something about. So this is just one of the things that we can do, I think, as a state.
Oh. And Dr. Gogo, you mentioned having previously treated users of tobacco. What are doctors seeing as the consequences of tobacco use in your field?
Well, I can be more specific than that in terms of how it affects Vermonters. So the University of Vermont Medical Center is the only center in the area that does what I do, which is stents in heart disease patients. And we do over 1,200 of those procedures a year collectively, and over 400 heart surgeries. If you look at the smoking rates of Vermonters, it's around 14% or 18% or so. More than half of the patients who undergo a stent procedure or a surgery every year, more than half, 55%, are current smokers. So you can see the burden of this. Even though it's a smaller population of Vermonters that smoke, they are disproportionately the patients that we see in the hospital. And that is expensive. Our heart surgery cost to Medicare is $55,000. That's how much it costs. A stent procedure with someone with a heart attack is $20,000 to $25,000. And you multiply that by 1,000 or by 500, and that's the true cost locally of heart disease to what we see every day.
So what are the health benefits that you would be seeing with a higher age limit?
Well, I would hope that that leads to a decrease overall in smoking rates, but for me it's a long lag time. The patients that I'm treating for heart disease are in their 50s and 60s and 70s. So it'll hopefully be my trainees who see that decrease in smoking, decrease in heart disease related to stopping smoking. But it is a long lag time, but it is definitely worth it.
So some people have argued that if we allow people to join the military and vote at 18, then they should also be allowed to purchase tobacco. What do you say to this?
Well, I can take that one because I wrote about it for the Free Press.
Please do.
So this is one of the most inconsistent arguments about what is the age of reason for making some rational decision making. But the military has already taken a stance on that. So, for example, in Hawaii, Hawaii was the first state to pass Tobacco 21. And the military command of Hawaii said that they would follow the state law. On U.S. military bases in Hawaii, the age to purchase tobacco on the U.S. military base is 21. They also, Admiral Fuller, not doctor, I'm too used to that. Admiral Fuller, who was head of Hawaii Command, also suggested that tobacco is the #1 impediment to readiness and fitness for U.S. military. U.S. military. So there is already a movement within the military to come at smoking and try to reduce it as much as possible. And so if you see local ordinances, a lot of the military bases are following them. And then military bases themselves are, like, for example, decreasing or banning smoking in recreational facilities, for example. And of course, they no longer supply cigarettes for free in their meals ready to eat. They used to do that in World War II, which led to the biggest increase in smoking in America in the last 100 years. So there's been a big change in the way the military approaches tobacco. So using the military and being able to participate in military activities as an excuse to be able to smoke a cigarette is becoming less and less a valid argument because of the military readiness and fitness issues that they've already talked about.
So, Tatiana, could you tell us how you and your friends have been involved in raising awareness about tobacco prevention issues and maybe why you're interested in this?
Well, I'm interested in it because I want to prevent as much as I can from people getting sick and dying prematurely from it, and just from the habit, because it can harm you even if it doesn't have you die prematurely. But we've put up signs around my school, and we put some signs up that had the little Terry thingy for 802 quits for people if they had a parent who smoked or a friend who they wanted to stop smoking. And we made these little like quit kits that had like some hard candies in them and some things like to fidget with if people were having a hard time like without using tobacco. So.
And is this an above the influence group at Edmunds, or what are you guys?
Yeah, we're in it's called Be Above, and we deal with that type of thing.
Okay. So if I don't smoke, why is this a benefit for me? Like, if I'm not getting the health benefit necessarily from it?
I think the biggest thing is secondhand smoke. So there's robust literature about how harmful secondhand smoke can be for people, especially people living in the same household. So a teenager who smokes or a parent who smokes can lead to other illnesses in the other members of the household. It's one of the big reasons why we've banned smoking in a lot of public places, because secondhand smoke can be very harmful. And in terms of vaping and e-cigarette products, the literature is still not there for whether or not those are truly safe as secondhand exposure. So there's a big unknown as to whether they are theoretically safer than cigarette smokes, but secondhand exposure to these vaping products has not been deemed safe by any means, and there are potentially other things within vaping that can be a problem for secondhand exposure.
Yeah, for me, you know, as somebody who has had a long history with respiratory illness and a lot of sensitivity to secondhand smoke, and I have had a lot of problems trying to avoid, you know, I don't smoke, but it's been hard for me to avoid smoke in a lot of situations. So I think that the more we can do to reduce that secondhand smoke in our environment is certainly helpful to those of us that don't smoke, and even more so to those of us with increased sensitivity levels.
There's a cultural thing here too. So there was a study that came out just last year showing that you're much more likely to smoke if your friends smoke.
Yeah.
And I'm sure you can attest to it, there's a fair amount of peer pressure as a teenager. So the more of your friends that are doing something, the much more likely you're going to participate in the activity. So if we're talking about decreasing even just preventing one member of a peer group from smoking by this kind of thing that we're trying to do, that would probably have effects on teens who don't smoke, because there would be a lot less peer pressure that you would have to experience in that situation. And
there's also pets, because pets can be very impacted by secondhand smoke, and they can also die prematurely from it. So if you care about your pets, then you don't want to expose them to secondhand smoke.
And do you think the people of Burlington are going to be supportive of this issue, especially the smokers?
Smokers, I think historically we've kind of gotten some mixed reviews, and in some ways this does not directly impact a lot of the smokers the way other initiatives we've taken impact them, like banning smoking in bars and clubs really affected most of the smokers, whereas this is more about trying to prevent people from getting addicted in the first place, and talking more about people who maybe haven't started smoking yet. So I am not sure. I'm sure the news crews will be out interviewing the smokers on Church Street, and I don't want to speak for them, but I wonder if they might be a little bit more amenable to this. And I hope that the citizens of Burlington will support a healthier lifestyle and healthier environment for all of us, and support the Tobacco 21 initiative.
I can speak to this both with anecdote and with data. So I have a couple of patients, but I'll tell you about one who has tried at least 5 times to quit smoking despite having multiple procedures for his heart disease. And when you ask him directly, you know, how come you're still smoking? He says, I can't stop. How old are you when you started? I was 15 years old. This is told to me over and over again by patient experiences in my clinic. But data-wise, a survey was done on patients who've had stent procedures and heart disease procedures. And overwhelmingly, those that have smoked wish they could never started. And the average age of starting, it reflects the national data for the average age of starting smoking amongst heart disease patients is before the age of 18 now. Way back in the 1960s was before the age of 18. So both with anecdote and with data, there is a good reason for smokers, at least the majority, maybe a narrow majority, to also support this kind of thing.
Yeah, and I think the CDC did a report on this a few years ago, and that's what they found too, that 7 out of 10 smokers support raising the age of use, and that in general, like 3/4 of the adults support raising the age to 21. It's one of those things that kind of just makes sense, that people get that we want people to wait and make that decision when their brain is in a place to make healthier decisions and ready, and their brain is developed enough to think through the consequences of that decision too.
Is there anything else you want people to know about this issue that we haven't covered already?
Well, I think this age thing about when, is there a line in the sand where suddenly you turn a certain age and you're able to make rational decisions?
Yeah.
It's a spectrum rather than a line. And we know this from, for example, you can't get cheap car insurance till you're 25, and they do that based on data. They know that people may not make so rational, especially men between 18 and 25, may not make such rational decisions behind the wheel, so they appropriately charge us more for car insurance. If you want to have the responsibility of making decisions at the federal level as an elected politician, you cannot do that until you're 25 for a member of the House of Representatives. You can't even be president of the United States till you're 35. So there's no line in the sand for this is when you can make a good decision about something and not. It's a spectrum, and we have a long literature suggesting that there are certain age cutoffs where we think things are appropriate. We don't think people should be making national decisions at the age of 23 in the United States. That's true.
And I think consistent messages are important. So we've now, all of our schools are tobacco-free in Vermont. A lot of the college campuses in our state are going tobacco-free. UVM became a tobacco-free campus a couple of years ago, St. Michael's, and across the state, they're looking at that issue. And all of that is because we want to set a tone that encourages youth to make healthy decisions. And I think this is just another way for us to create, to reinforce that same message that we want you to live a healthy lifestyle, that this is a healthy state, and we support making healthy decisions.
All right. Well, thank you all so much for joining us. If you want to find out more information about this, you can visit the Burlington City Elections website or tobacco21.org, which is the national organization on this issue. But I think that's all we have to say for today, so thank you.
Thanks, Julia.
Thanks, Julia.
Thank you.